Hello, happy Tuesday. I am going to attempt my first official video blog as opposed to trying to explain my thoughts and all the procedure in the sense that we've gone through with our oldest daughter, who I refer to as little C on here, over the past 2 years. So anyone who has known us, you would know that a couple years back she experienced some immobility in the sense in her joints, in her hips, and over the last probably year or so she hasn't experienced a whole lot in her hips until again this fall, but it moved into her ankles. They didn't really have any explanation, knowing that she would respond to Advil anti-inflammatory meds. She didn't have anything that showed up in her blood. She didn't have any real swelling or heat of the joints, and all the different symptoms that would point towards arthritis. So just finally this December, we got in with the BC Children's Arthritis Society or program, and they started doing some studies. They've done x-rays, and the thing that actually concerned them most was her wrists. And though she does have discomfort time and time again, like in her legs, it's never really been an issue with her wrists, but we've always known, probably for about 4 years or so, that her flexibility isn't so great. So this is kind of like how her hand would bend, whereas typically like you could do a handstand or a cartwheel, and it was brought to our attention back when she was in gymnastics years and years ago, and nothing really came of it when we visited our family doctor, or when she was in and out of the hospital for her joint pain in her hips and her ankles and that. But as soon as we got to the pediatric specialist, they immediately zoned in on her wrists. So since our appointment in December, we went back this past week, and there has been now some inflammation that has shown up in her knuckles on both sides, and fortunately, the worst hand is actually her non-dominant hand, and they've started her on a few different medications to try to blast out any inflammation that has appeared. Her ankles have now started to show signs of swelling, as well as a little bit of hot heat when you touch it. So they have diagnosed her at this point in time with arthritis, and here in Canada, they just refer to it as arthritis in the medical field. But if you're Googling or looking into anything, a lot of the studies online, especially ones coming out of the US, are juvenile rheumatoid arthritis. And they're hopeful. They've done some tremendous advancements, especially through the program at BC Children's, where there's loads and loads and loads of testimonials of people that have come in and been not so much like you're not healed for life, but you kind of go into a remission and lead a very normal life. So Di and I are really excited to finally have some answers and some methods that we can implement within our home. And thankfully she's lived a fairly pain-free, as well as her life hasn't really been inhibited in any way due to the situation. So, plus she is the best trooper. She, whether it's being glasses or when she had to do patchwork, and the doctor says take this medicine and do this, do that, and she is a little bit anal in a sense, that she's like, oh, I gotta take it. And so keeping our fingers crossed that though this medication could cause some nausea and stuff, Sharnay does want to be better, so she's really keen on being consistent and listening to what the doctors say. So anyways, it's continuing with the BC Children's as well as our pediatrician, and we have great specialists that have been working with her eyes, and now we do a physio, occupational therapist, and definitely grateful for the medical system that goes above and beyond and has really taken care of our situation and taken it seriously for Chardonnay's sake. So anyways, we'll keep you posted. Thanks so much. Bye.